the average person doesn't really know what's going on. Was that part of the problem during all of this, that the average person didn't really know what was going on, Michael?
I think that's probably the case. They don't know. It's hard for the average person to follow what's going on Capitol Hill. And so unfortunately, the members of Congress and the President hear mostly from the special interest groups. And the legislation tends to reflect what the special interest groups want more than what the public wants. That's why all the special interests are in favor of this legislation while the public is against it. But I think all of those folks there on the street are making valid points. Healthcare, although it's a concern for a lot of people, was not as big a concern this year as the economy has been, because I think more people were affected and hurt by unemployment than were affected by the fact that they had high healthcare costs and weren't able to pay those bills because they didn't have health insurance, or even if they did have health insurance. That said, the problem is not that there's a lot of complaints about bickering in Washington. I think the answer to that is 'twas ever thus. There's always going to be bickering when it comes to politics and politicians. The problem is not that we don't know what the problems are. The problem is we have different solutions, and we need to, and people don't agree on what's the right thing to do. So I think that one thing that we need to do is educate the public more about exactly what's going on with our healthcare sector, why healthcare costs are rising so much. And I think the main reason is because we have too much government involvement as it is. We have the government providing too many healthcare subsidies. The government already controls about half of our healthcare spending. The government controls even more of our healthcare sector indirectly through all the rules that it imposes on doctors and hospitals and insurance companies and patients. And I think that one perspective that hasn't been given its due is the idea that we need to pull back the government involvement in healthcare. Whereas this legislation that looks like it's headed toward defeat is headed in the opposite direction. It's trying to increase the government's role in healthcare. And I think that if we do that, then we're likely to just get more of the same. We're going to have costs that keep on rising. The quality is going to be stagnant and even falling in many places. And there's this sense that if we can just get the government to guarantee health insurance and healthcare to everybody, then that will make everything better. But there's an old expression in these debates. It goes, if you think that healthcare is expensive now, wait until you see what it costs when it's free.
Karen Davenport, one of the most contentious parts of the argument, I think was alluded to by Michael. How much government involvement? Yet if you look at the things people complain about, not being covered when they're sick, being rejected for pre-existing conditions, various ways that the insurance companies can cover well people and get them to pay premiums and then avoid taking care of them when they're sick. That's where a lot of the anticipated government intervention was going to come. The government was going to say, sorry, you can't do that. Mm-hmm. Yet, at the same time, people said, keep government out of my health care reform. Keep government out of the way I get health care.
Well, I think there's a real paradox in how people think about this. First of all, the bills that are pending in Congress help people get access to private health insurance, by and large. Certainly there is also an expansion of the Medicaid program for very low-income people, but the real focus is on creating a better marketplace for private insurance and helping people be able to purchase that. And you know, sort of along this paradoxical vein, one of the issues that was very prominent this year but has fallen off the table was the idea of a public health insurance option, which still exists in some form in the House bill, but it has largely fallen out of the public discourse. At the same time, if you look at polling on the public health insurance option, it remains more popular than the bills as a whole or any of the policymakers who are opposing or supporting this legislation. So there's a real disconnect in some of the rhetoric and how things are being looked at in terms of what should government's role be in the healthcare system. I think that there continues to be a desire for government to set the rules of the road in terms of insurance plans and what kind of practices they're able to use. So, you know, maybe this is part of the debate not being so much on the substance as a lot of attention on the process. But I think that there is a desire and a need for the appropriate level of government role in the health insurance markets and in the health insurance system.
This was often spoken of as a government takeover of healthcare. Daily spoken of as a government takeover of healthcare. Was it?
Well, I think if you look at some of the ideas from both of the major bills, from the House and the Senate, yeah, I think that by and large there was a bigger government, a government basically deciding what type of health insurance works best for certain individuals. And I think that put off a lot of people. Our thing really, one of our ideas that we'd like to see happen is why does health insurance have to be tied to the employer? Why can't it be more like life insurance or auto insurance, particularly for our Hispanic community who tends to work for a lot of different businesses or employers? Something like that would be very beneficial to us, and obviously for a lot of other Americans, including the young lady who was in the segment who said that her the store she worked at didn't offer health insurance. If we were to look at and not penalize people to buy health insurance out of in the private sector, I mean, that would be a quick fix and really get at the heart of a lot of the complaints about the current system.